Mic check, 1 2 3. Mic check, 1 2 3.
I took the one out at the bottom though, where it usually says about comply, directed to comply. This one just says to use, directed to use the utmost diligence. You know, I think that's different. You know, it's not telling you. Did you read it? Did you read it? I think you're okay with it. Down below is what really. Read it again, Randy. Yeah, I think you'll see what I'm talking about. Because down below where we put, well, I didn't look at that. The utmost. This is the one. Mind if I move this? Oh, sorry. Bear with me, folks. I've got electronic notes too. So, thank you all for coming today. Callaway County, I'm Gary Youngerman, presiding commissioner of Callaway County. We're here today along with all of the incorporated cities, or most of the incorporated cities in Callaway County are represented up here for a press conference to relate to COVID-19. The Callaway County Commission and all the incorporated cities of Callaway County have issued a state of emergency declaration for Callaway County and all the incorporated cities. This is being done to allow the county access to state and federal assets and funding due to the current COVID-19 pandemic. It is important to mention that the response organizations within Callaway County, the schools, the colleges, have all planned and practiced and exercised for pandemics that would hit Callaway County. And I feel like we are well prepared to deal with such pandemic. At this time, I would like to have Mr. Kent Wood from the Callaway County Health Department come up and make a statement, and he will be followed up by William Woods University.
Thank you, Gary. Callaway County Health Department received notification of the first travel-related COVID-19 case in Callaway County. This case is located in Fulton, Missouri at William Woods University. The patient has self-isolated at this time following Department of Health and Senior Services and Centers for Disease Control in Atlanta guidelines. There will be no further personal patient information given. The Callaway County Health Department is working closely with William Woods University on this case. William Woods University opened their Emergency Operations Center upon notification of this case and staffed the facility with well-trained individuals to assist with student health and resource management. This group has worked tirelessly to ensure student and community safety. We will continue to work with them to ensure CDC and DHSS guidelines for cleaning, quarantine, and isolation, if required, are followed. Callaway County Health Department is working with DHSS and CDC through our Communicable Disease Unit to identify and contact people who may have come into contact with the individual while they were infectious, and will monitor them for fever and respiratory symptoms. To reduce the risk and prevent the spread of COVID-19, we encourage these following basic preventative measures. Wash your hands often with soap and water for at least 20 seconds, or use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, mouth, or face with unwashed hands. Stay home if you're sick. Cover coughs and sneezes and cough into your elbow. Clean and disinfect high-touch surfaces frequently. If you suspect that you have COVID-19 or been exposed to someone who has COVID-19, call the COVID-19 hotline number at 1-877-435-8411 or contact your healthcare provider. It's critical that your provider is aware that you may have COVID-19 prior to your arrival at the healthcare facility. Once directed to a healthcare facility, please follow all instructions given there to protect yourself and others. And with that, I would like to turn it over to our friends from William Woods University. John, please.
Okay. I'm John Fougere from William Woods University. In light of the presumptive positive test result of COVID-19 by one of our students, we've begun the process of facilitating the return home of the students remaining on our campus. We also instruct our employees today to remain home for the time being. We believe it's critically important that those students that do leave campus depart in as best health as humanly possible. And as such, we have set up 2 screening stations on our campus to determine if students are running a fever or showing symptoms before they depart. We want to ensure, again, to the greatest extent possible, that our students do not leave campus, go home to their hometowns, and potentially infect family members or other acquaintances when they do leave. We have also been strictly following all Callaway County Department of Health, Missouri Department of Health, Centers for Disease Control guidelines when it comes to procedures for quarantining students, which is where the current student is, and also other students that may have come in contact with that person. So, I guess questions now?
Yeah.
Okay.
Do you have any idea how many that student may have come in contact with?
At this point, we're still doing those breakdowns. We're asking those questions. We are having several calls come into our department at this time. We have had some tests that have been run for folks that were in close contact with her, but we do not have any test results back at this point.
How many in-county tests have been performed? Because I understand that this positive test was as a result of a test that took place in Columbia. How many, if any, takes place in Callaway?
At this point, I can't answer that because the testing has been expanded quite rapidly, and I don't have that number for you, but I can get that for you.
As far as students who are being sent home, you mentioned that you don't want to send them home if they're displaying symptoms. Are they being screened in some way?
We will have screening sites set up, and we will be screening everyone that's going to be potentially leaving. Right now, everyone is quarantined to the facility. We will screen and then go through proper procedures through CDC and DHSS regulations.
What do those procedures say if a student is showing symptoms? What's the protocol for?
We plan on quarantining in place there to reduce the risk of anyone spreading into the community.
How long do you expect I don't know the word for it, investigation into who has come into contact with it? You said you're in the process of identifying who has been in contact with that person. How long do you expect that process to take?
That process will continue until we have exhausted the members and the students that are there at the facility, as well as staff.
So no timeline of
We are doing them as quickly as possible as we can get to them, yes.
This may be a question for Commissioner Juggerman. Is there, under this state of emergency declaration, are there any restrictions on businesses, on gatherings, or anything like that?
I think all of us, the county along with the incorporated cities, really want to reiterate the state and national suggestions, which is, wash your hands, social distancing, and we do recommend that groups of 10 or less. We need to really focus on keeping groups of people not together, big groups. So our emphasis at this point is to suggest to businesses and everybody else in events that cancel those events, and if it's 10 or more, please cancel that event, because we need to practice social distancing, cleanliness, and all that stuff to try to limit the spread, because I think that'll do it. That's going to help us tremendously in what we know to be true today through the CDC and everybody else, that social distancing and cleanliness is going to make a huge impact.
But to be clear, this is still a recommendation, an urgent recommendation, but not a force of law or ordinance.
In my opinion, it's an extremely urgent suggestion. This pandemic's changing hourly, as we all know. I mean, it's changing. By the time we get across the street here in a minute, it'll probably be different. But so things will change day to day, I would say, to more severity of requesting and asking businesses and event centers and whatnot. But right now, we are highly suggesting, and I think locally here, they're doing a pretty good job. I really do. I think they're looking for guidance too, and we're trying to protect the citizens of Callaway County, but also watch out for, our small business owners and different things. It's a struggling time for them. And so we hope we don't have to shut them totally down, but we would suggest that they try to keep patrons out of their facilities, but still stay open to delivery, carry out, stuff like that. We encourage that.
Just a couple more questions from me, I promise. As far as the William Woods, is there a reason that the decision wasn't made to clear that campus of staff and students earlier?
Well, Joe, I think what we did was actually very consistent with other colleges and universities across the country. A week ago today, we instituted a policy of going to all online classes, which started this past Monday. We also gave our students the option to remain on campus or to go home. I believe that's the same approach that Mizzou and some other area colleges did, and others around the country. However, one day ago, we started the process of letting them know that it was time for students to prepare to leave. We also said the same message ostensibly to our employees to start preparing for working from home. Obviously, this instance of a presumptive positive test changed things and expedited that process.
Lose the mic. Okay.
Is the mic out? Okay.
And I just had one more question for Commissioner Juggerman. We've seen other counties and cities and the state of Missouri and the nation declare states of emergency prior, and it's only happening in Callaway County now. Do you feel like you had, you and the staff and the leaders of the different municipalities, you feel like you had time to prepare, and you feel like you're prepared for this increased status?
Yeah, and I think, I think most of us waited. We wanted to wait what we felt like was as long as we could. But, once you have that next day comes and you have a severe change, it's time to make some changes on how you're doing things. So, and really in doing this, we're just heightening the everybody's conscience to do better. And it also allows us, as I stated earlier at the beginning, it allows us then to have a better odds and chances with funding that's coming down. So, and we all know that the funding for the national and state levels, it's in short supply, and we're all doing the best we can. This is a pandemic that we're learning more and more every day about it, and what we know today is that if people just try to social distance and wash their hands and do the little things, that we can keep this thing under control.
And last question from me, that is, could you reiterate, this is an emergency declaration for Callaway County, exactly what actions are going to be taken? How is this status going to be utilized?
Right now, the utilization is basically what I said. I'm going to kind of sound like a little broken record here. But we're extremely emphasizing that the citizens of Callaway County abide by the state and federal suggestions that have been put out there. We're not mandating them. We're highly suggesting at this point. Things could change tomorrow on how we approach this, but right now, we are just, we're asking them to please make the efforts to social distancing, washing, all that stuff. That is what we're asking them to do at this point. But as I said, tomorrow may be a totally different day.
You mentioned you were screening students. What is that? What is that screening process?
We will be checking the temperatures of each one of the students as they come through. We will bring them through at no more than again, the magic number of 10. But we will be taking temperatures. We will be asking questions of their health. Have you been in contact with someone else? Do you feel sick? Have you had a temperature? Have you been in contact with someone else that may be positive? Or have you been in contact with someone that you know is our case? At that point, we will ask those, and if we have some no's or we have way too many yeses, then at that point we will have to make a determination whether that individual is either quarantined there at the site or they could be free to go home.
Do you know how many students stayed on campus? How many are having to go through this process? John?
I believe at the start of the day we had approximately 300 today. Now what's been happening in the last week is we had students, each day maybe leaving or some staying on campus, but we had approximately 300 as of this morning. So obviously we're looking to expedite the screening process as quickly as possible and to facilitate the movement off campus and to move ahead.
And what temperature are you guys checking for? Like, what temperature is concerning or?
We're going to be looking for anything over 100 degrees or higher, per CDC, per DHSS.
And just for the people who are kind of watching right now, we're Facebook Living, they're a little bit concerned. How do you want to reassure them that the county is prepared for this?
Well, as Commissioner Youngerman said earlier, we have planned and have exercised pandemic exercises for years. This is not anything new. We're not reinventing the wheel, but we're actually putting it to use now. And by saying that, that means our community partners, William Woods University, all of our small towns, we've all practiced at one time or another on different avenues of these types of plans. We have them in place, and this is just going to be another one that we're there, and we're going to be working through it.
Forgive me, could you repeat your name and title?
Kent Wood, Environmental Public Health Specialist and Emergency Planner for Callaway County Health Department.
How do you plan on helping students or is there a plan in place for students who aren't able to go home?
Absolutely. We have a certain number of international students, and we're working with them on alternate accommodations as we go. We understand that this will take some time, longer than having everybody out today. So again, we have to work closely with them. We know that some of them have different home situations and nation situations that make it, as you said, impossible for them to go right now or very difficult. So we're working closely with them to find alternate accommodations for them. Yes?
This has already been said, but do you know when exactly the student tested positive, like when that test occurred?
I believe that was the Thursday night, but I'm going to leave that to Ken. Thursday, yep.
That was when confirmation came.
Okay. Yes, thank you.
No. Just want to thank the media. I think we've been, just once again, one last time, we're just preaching and want people to practice social distancing and hand washing, and let's do some good things and try to control what's going on. The other thing that I will say real quick, just so you know, I'm pretty sure, and I'm safe in saying this, that the one positive that we have is quarantined along with a lot of other people, but it's in one building, okay, in one of their facilities. So we feel like we've kind of got this thing, you know, in just one area, and we'll keep that hopefully there depending on how this investigation goes with other students. But right now, it looks as if everything is contained to that one spot. So, thank you all.